there are a lot of definitions of what a concussion is. It's kind of mind-boggling and sort of adds to the confusion of what concussion is. Most definitions will say that if there's loss of consciousness, it's less than 30 minutes. Typically, oftentimes there isn't loss of consciousness, and symptoms generally, not always, resolve within days to weeks, sometimes a little bit longer. So a concussion is a traumatic brain injury, but it's considered on the milder end of the spectrum continuum. So if there is loss of consciousness, by definition, it has to be less than 30 minutes based on most definitions. And the symptoms generally resolve within hours, days, weeks, sometimes a little bit longer. When there's an injury to the brain, let's say a concussion, the first thing to realize is the brain is actually very soft. It has the consistency of formed jello. And when your head gets jerked backwards and forwards and sort of to the side, the brain can actually compress on itself, stretch, can twist a little bit. And that compression, that stretching, the twisting will actually stretch all of the nerve cells, or part of the nerve cells called the axons. And the axons are like telephone wires or like wires in a computer network. If they're stretched, there's going to be a period of time where they're just not going to work properly and they're not going to transmit information properly. And in order for us to do what we normally do as humans, think, remember, concentrate, maintain our balance, have our eyes and our ears coordinate properly so our balance doesn't go awry, all of that's going to be off, or it could be off. And those are the symptoms of concussion, and it's explained by the stretching of those nerve cells. Eventually, in the vast majority of cases after mild traumatic brain injury, things settle down and then your symptoms resolve.